Actually, every time that she got surgery, I'm crying.
Kasi she had so many surgeries already.
We keep on looking out. So if it's not possible in Philippines, we try to look outside the Philippines. We're based from the Philippines. We came from Philippines. Actually, we just visited Thailand last October just to seek for medical consultation about the possible surgery of her condition. We just here for last October for just vacation because we went to the zoo, to the Nong Noj just for her. And then we passed by the hospital for consultation. Yeah. And then everything happens fast. That's why we were here. Then we came back after a week later.
Before surgery, she already have the condition, spina bifida myelomeningocele. It shows already before I even give birth to her. So we already know that she already have the condition. And then when I gave birth, after 3 days, they already do the surgery to repair the damage on her spine, and I also put shunt because she also have Charity malformation and the hydrocephalus, but it's already controlled, so her head didn't really go big. It was okay for around 2 years, but in the late 2018, we noticed there's a wound at the back, and it becomes bigger and bigger. We seek treatment for her, but it's only just for wound management until it got infected, and she was really in pain. And they decided to do the operation to remove some bones and close the wound, because it's from 2018 to 2021 it becomes really big.
Yeah.
From around about this size to 4 inches.
Yeah.
4 inches the wound open. Once it opens, we're already trying to look for another option for her, but it's hard to find because she just had that surgery and they said that tissue is not that healed yet, so they cannot do another surgery again.
That's why we wait another year.
We waited for around
2 years again.
Because
that's 2022 that we started to notice the opening of the wound. Then we immediately we search for the surgeons that can do correction of her kyphosis, because at that time her kyphosis already developed. So we know that the correction of kyphosis is the needed operation for her to completely close the wound. And then we keep on looking out. So if it's not possible in Philippines, we try to look outside the Philippines.
Her back is always open, so I know it's prone to infections. It's really important for her to really have the surgery. We were told that if she can get also the infection for the brain if that is always open.
Where are we going?
Actually, she started going back to school around 2022, but we decided to stop her because of the wound. And then
she's in school, we're not always there to look after her, and there might be a danger when she played with other kids, or
the infection as well. Release the infection of the wound. At initial, in around October, that we met Dr. Atik home. When we actually met him and explained everything, and he told us that he can do the surgery. That's the point that we decided here.
It's really hard to find doctors who will agree
Yeah.
to do the procedure because she's really young for the procedure.
Yeah, because her case is classified as
Also
complicated case.
complicated.
Miss Samantha from the Philippines. She is an 8-year-old girl present with the chronic wound at the back. She have underlying disease of the spinal dysgenesis since her birth. The spine is disconnecting between L1 and L2, and also she have a myelomeningocele. She underwent the surgery for many times in the Philippines. Doctor in Philippines tried to fix her spine problem, but actually the spine problem is progression over the time. Her deformity developed the severe kyphosis. It is a CT scan of her, and finally the spine have protrusion over the skin, make her skin broke, and she have the chronic wound over the 1 year and have the infection of this wound. The doctor in the Philippines try to solve this problem, but with the many treatment over time, they cannot fix this problem. So her family make a decision to visit Bangkok hospital team to find out the treatment that can improve Samantha quality of life. For the spine problem, focus on my work for the Samantha. She have a spinal anomaly around L1 and L2 of the disconnecting spine, and also the spine have a severe kyphosis over there. So we have to do a resection of the spine and the spinal cord around here. We call this procedure is a myelokyphectomy. That means we have to resection almost 3 levels of the vertebra out and realignment of the spine together in the normal alignment, and have to fixation the spine with the strong fixation implant. So her spine will get stability, no progression in the future again, and the wound can be closed and healed with the spine and normal alignment.
Sammy need a multidisciplinary team. She has many problems in her body, and I sent her to see a cardiologist, and her test was normal. I sent her to hematologist because of she has prolonged bleeding times. Because of her bowel dysfunction, she has chronic constipation, and there are a lot of feces in her belly. I sent her to see GI doctor, and she suggests to do bowel clearance. Need around a few days, and the result is very good. But lungs problem, she has abnormal spine, cause her has restrictive lungs problems and risk of pneumonia or lung collapse after surgery. And our team plan with a rehabilitation team to help her earlier after operations. Respiratory rehabilitation is the good way to prevent pneumonia.
The problem of congenital spine deformity, and she have got maybe a few operations before, but the operation ended up with chronic wound for nearly a year. So when she coming up, we need to prepare the wound bed condition before the surgery. So we take nearly a month before operation. Mostly we prepare the wound care condition until wound bed condition is fulfilled. After operation, we have got some wound infection at post-operative period. At that time, we make decision to coming in and to remove the infected tissue. After that, we take care the wound with negative pressure wound therapy or vacuum dressing. Until now, everything going well. Healing process is going up well. No sign of infection so far. We will take another couple of weeks before everything is completely healed.
How do you feel after?
I feel happy
Why you feel happy?
because I'm in the hospital. Because I'm going to
Describe your wound is.
because my wound is fine.
Yeah.
Actually, at the first time that we after the surgery that we saw that her condition, the surgery was successful. They do the correction fine, and another concern before the surgery is the wound closure because due to the past surgery, there's a lot of flap muscle already used up, and then they use it up again and they made the closure successfully.
When Dr.
Aticom goes out and
room,
just to discuss that it's already successful
It's a
and just
success
waiting for the
closure.
For the closure. Yeah, that's a relief from us.
A very big relief.
Yeah. And after another day, they allowed us to see her back, and it's really straight and closed. So we're happy to see that actually that her back is finally straight, and the wound that our primary concern is closed.
First, of course, her doctors, because they really did a good job, and then also the nurses and how they look after her even before the surgery, during treatment first, before the surgery, and then also after the surgery. She really enjoyed taking a bath. If it's only just for us, it will be possible for her to have a bath on the bed.
Before the surgery last December, we are here in Thailand for more than a month just to prepare her wound before the surgery. So taking Dr. Jaturong taking care of her, and then other doctors. Actually, we consulted a lot of doctors before her surgery. They made sure that her body is prepared for the surgery. They really look every detail before the surgery.
Surgical outcome, we can collect the spine as we planned. So my goal is successful with my procedure combined with the team. We can correction the kyphosis to the nearly normal alignment. No more spine kyphosis. And very important, we can close the skin without the defect of the skin.
For the key elements for our success for this one, I think the most important one is the teamwork, and the second one is our collaboration, and also every key stakeholders in the Department of Pediatrics, such as pulmonologists, infectious disease doctors, pediatric intensive care doctors, and also supporting team in the Department of Pediatrics and operating room. Last but not least, I think this is the most important, the trust from the family, and thank you for trusting us. Thank you.